I think we'll just start calling the roll. You ready? Yeah. The House Health Policy Committee will come to order. Would the clerk please take the attendance?
Chair Rogers.
Here.
Representatives Whitsett. Here. Carter.
Here.
Hadsma. Neely.
Here.
Glanville.
Present.
Kafia.
Here.
Conlon.
Here.
Farhat.
Here.
Fitzgerald.
Here.
Miller. Representative Miller.
Are you on Zoom, Rep. Miller?
Here.
Thank you.
Reingans.
Here.
Vanderwall. Filler. Mueller. Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson. Is Thompson on Zoom? No? Okay, Madam Chair, you have 14 members present. You do have a quorum.
Thank you. Whatever plague is going through that Rep. Filler is spreading in the Republican caucus, I don't want a part of it. Representative Fitzgerald moves to approve the minutes from our meeting on November 14, 2024. Seeing no objection, the minutes are approved. I would like to take a moment to recognize the students visiting health policy today from the Henry Ford MPAC class from Wayne State Medical Society. Prior to testimony and votes, if you wish to speak or express your position on legislation before us today, please submit a card to the clerk. Sergeants are in the room and will be happy to collect the cards and get them to the committee clerk on your behalf. In the interest of time, you are also welcome to submit written comments to be submitted to the bill record. First up, we will be taking testimony on House Bill 5964, sponsored by Representative Conlon, and then 5938, sponsored by Representative McDonald. We will then vote out House Bill 5938. We will vote on House Bills 5283 and 5284, sponsored by myself and Rep. Vanderwall. Senate Bill 668, sponsored by Chair Hertel. House Bill 5636, sponsored by Rep. Pohutsky. House Bill 4833, sponsored by Rep. Puri. House Bill 5616, sponsored by Rep. Stuckloff. House Bill 517, sponsored by Rep. Reingans. House Bill 5371, sponsored by Rep. Braybeck. House Bill 5372, sponsored by Rep. Green. And House Bill 5785, sponsored by Rep. Braybeck. Last, we will be voting to re-refer House Bill 5904, sponsored by Rep. Paez, to the House Committee on Regulatory Reform. First up on the agenda, we will hear testimony on House Bill 5964, a bill regarding the physician licensure interstate compact sunset repeal, sponsored by Representative Conlon. Welcome to Health Policy. Thank you for making the long journey from your seat.
Good morning, Chair Rogers and members of the committee. Thank you for allowing me to speak today to House Bill 5964. This legislation is very simple. In Michigan, we already have an interstate medical licensure compact, which allows physicians who are licensed in other compact states the ability to seek licensure easily in Michigan. HB 5964 removes the sunset on the compact, which is set to expire on March 28th of 2025. We all recognize the unfortunate reality that there is a shortage of medical professionals within our state. The compact, as it exists, helps remedy the issue by incentivizing practitioners to move to Michigan without the burden of seeking entirely different licensure. We welcome all the help we can get to keep Michigan competitive, and to allow this practice in perpetuity just makes sense. We should also not forget that this bill is also about protecting access to health care for Michigan residents. Testifying with me today on Zoom is Dr. Salome, the Chief Medical Officer at Trinity Medical Groups. We are both happy to answer questions after his testimony. Thank you again for allowing us to speak to HB 5964.
Thank you. Dr. Salome?
Thank you. Can everyone hear me okay?
Yes, we can. Welcome to Health Policy.
Thank you. Good morning, Chair Rogers and members of the House Health Policy Committee. My name is Dr. Mohammed Salme. I'm the Chief Medical Officer of Trinity Health Medical Groups, which is part of Trinity Health Health Corporation, which is a multi-state health system with its largest presence in the state of Michigan. I welcome the opportunity to share my thoughts regarding Trinity Health's position on House Bill 5964, which is the legislation that removes the sunset for participation in the Interstate Medical Licensure Compact. In the state of Michigan, Trinity Health Medical Group, between Southeast Michigan and West Michigan, manages 700,000 attributed lives in primary care. And with our specialty services and hospital services at any given time, we take care of up to 10 to 15% of the state population, including in high need areas such as Muskegon, parts of Oakland County, parts of Wayne County, and rural presence, significant rural presence in the Lakeshore region. The Interstate Medical Licensure Compact allows physicians the opportunity to utilize one process to be licensed in multiple states, which really speaks to the access issue. It allows us to be more competitive in attracting candidates who are able to practice in other states that participate in the compact. And really, from my perspective, it's really all about access and allowing our physicians to be more flexible in their ability to serve patients, particularly in rural areas and high need areas. We onboard more than 100 providers per year. And I think this process streamlines the ability to get licensing and start practicing, which is, I think, a goal for all of us to achieve by providing exceptional health care to folks who need it. Happy to answer any questions and would appreciate the committee's support on this legislation.
Thank you so much. I see Representative Carter.
Thank you, Madam Chair, and thank you both for your testimony. I understand this very important bill will increase physician mobility, and that in turn will increase access to care. But can you tell me how this would be adapted across the state? How will this system be utilized? I understand that how it works, but I want to look at the end results.
As far as how it's utilized across the state, when physicians apply for a license, they must, as part of the compact, pick a primary state and then all the other states they want to participate in. And we're a multinational, a multi-state national healthcare corporation. It allows flexibility for folks practice in more than one state at any given time. And wherever we have the ability to get licensing in a more streamlined fashion, we can utilize and leverage folks to be available for patients in our service areas, which cover a significant portion of the state of Michigan.
Follow up, Madam Chair, just a quick one. So in other words, this would, like up in the Upper Peninsula where it's pretty much desert areas for physicians, it will allow that mobility for them to traverse to various parts of the UP and provide those services through this compact?
Yeah, I think the compact benefits the entire state. I'm speaking specifically to Trinity Health's support of that, but as a physician, a practicing physician, and someone who really is intimately aware of the onboarding and recruitment process, wherever the compact is in place, it does streamline recruitment, including rural areas such as the Upper Peninsula, where I actually had practiced previously before being with Trinity. So it is vital, particularly for those types of areas that have difficulty in getting providers in more remote locations.
Seeing no further questions, thank you very much for your testimony. We will be taking up this bill for a vote likely next week. And I have cards to read in supporting the bill. Blue Cross Blue Shield of Michigan, Henry Ford Health supports the bill, Michigan Health and Hospital Association supports the bill, Michigan College of Emergency Physicians supports the bill, Bronson Healthcare supports the bill, MIOTA, the Occupational Therapist Association, supports the bill, Michigan Association of Health Plans supports the bill, and AARP of Michigan supports the bill. Next up on the agenda, we will take up House Bill 5938, sponsored by Representative McDonald, regarding dental credit cards, which has a substitute that should be in front of you. We will first adopt the H2 substitute. Representative Mealy moves to adopt the H2 sub for House Bill 5938. Madam Clerk, will you please take the vote?
I just have to get my vote sheet. To adopt the H2 substitute to House Bill 5938, and the motion was made by
Representative Mealy.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Pardon me?
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kapia.
Godey's call the chair. Health policy will come back to order. Please continue the roll call.
Representative Kapia. Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingens.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Robb.
Yes.
Schmaltz.
Yes.
Thompson. I have not announced it. Madam Chair, you have 13 yeas, 0 nays, and 0 pass. The substitute to House Bill 5938 is adopted.
Thank you. Representative McDonald, go ahead.
Good morning, Chair Rogers and members of the committee. Thank you for the opportunity to give testimony on my House Bill 5938. Excuse me. The bill regards insurer reimbursements that go to dental care providers. Increasingly, these reimbursements are being made using something called virtual credit cards. Virtual credit cards, or VCCs, are online payment methods that generate a temporary credit card number for each transaction. Unfortunately, the increased use of VCCs among insurers harms providers in 2 ways. First, VCCs work like regular credit cards, so providers must pay processing fees. These fees can take away 2 to 5% of the reimbursement amount, which could be anywhere from hundreds to thousands of dollars. That kind of loss can hurt dental practices financially, of course. In short, when dental practices are paid via VCC, skip that. HB 5938 would simply require insurers to offer dentists multiple payment options, including at least one method like checks or electronic transfers. That ensures that dental providers receive 100% on the agreed upon reimbursement. Insurers could still offer VCCs, but dentists would have the chance to avoid them. And one other detail that this creates also some extra administrative work that can also hurt the practice. So with that information, I will turn things over to Dr. Vince Benavenia, who's a practicing dentist at Mid-Michigan Oral Surgery. But before I do, I'd be happy to answer any questions, probably with his help.
I think we'll just take questions at the end if that's
I
okay.
think that's a good idea.
Welcome to Health Policy, Dr. Benavenia, and begin when you're ready.
Good morning, and thank you, Chair Rogers and members of the committee, and thank you for taking up House Bill 5938. I'm Vince Benavenia, and I'm a practicing dentist here in East Lansing, oral surgeon. I'm here today to testify in support of Bill 5938. What is the purpose of this legislation? HB 5938 requires insurance providers to offer alternative payment methods beyond virtual credit cards, ensuring that dental professionals receive 100% of the agreed upon payment amount. Alternatives to VCCs include direct bank transfers, checks, and electronic fund transfers, ETFs or EFTs, which do not carry the same burdensome transaction fees of administrative challenges. What is a virtual credit card? A virtual credit card is a digital payment method issued by insurance providers to provide to pay for dental providers that generates a temporary one-time use credit card number for reimbursement. The issues faced by the dental providers using VCCs, there's transaction fees. VCCs payments often come with higher processing fees, typically 2 to 5% compared to other payment methods. For example, a dental reimbursement of $100 to $200 per procedure will be subject to a 2 to 5% fee, which can quickly add up when a patient undergoes multiple procedures. These fees quickly add up over a few months and 1,000 procedures. The fees come after a dentist has already made agreements with insurance companies to provide services below their standard rate. There is also an administrative burden to our staff. Managing virtual credit card payments creates additional administrative work for dental offices. Staff members must handle card information, reconcile payments, track important details like card balances, expiration dates, transaction histories. This increases the workload of our office staff, taking away time from patient care, and further increases costs. We support alternative payment methods to ensuring fair compensation. The core issue with virtual credit cards is that they prevent dental professionals from receiving the full reimbursement they are entitled to due to the processing fees. Alternative payment methods such as direct bank transfers, checks, and electronic fund transfers can ensure that dental professionals are paid 100% of their agreed upon fee. We support alternative payment methods to simplify payment systems. Transitioning to these alternative payment methods would simplify the process and reduce the administrative burden on dental offices. It would allow office staff to focus more on patient care rather than managing complex payment processes. In conclusion, the issues surrounding virtual credit cards are real and impactful for dental practices, which are small businesses. The added transaction fees and administrative burden reduces the reimbursement that dental professionals receive, which ultimately affects their ability to continue providing quality care. I urge the committee to consider supporting measures that ensure dental professionals are paid fairly and that payment systems are streamlined for the benefit of both providers and patients. Thank you for the time and consideration today.
Thank you for your testimony. Are there members with questions? Representative Carter.
Thank you, Madam Chair. As chair of the Insurance Committee, I'm very pleased to hear that the plans that I've spoken to supports this legislation. And it's always good to see providers and insurers work together. So I just wanted to make that comment. Thank you.
Appreciate that.
Anyone else? All right, we have some cards to read in. So supporting the bill, Michigan Dental Association, and neutral on the bill, Michigan Association of Health Plans. We are going to vote this bill out. So Representative Neely moves to report House Bill 5938 with recommendation as substitute H2. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Woodsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller, Reingens,
Yes.
Vanderwall, Filler, Mueller, Van Workum,
Pass.
Roth,
Pass.
Schmaltz,
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 3 pass. House Bill 5938 is reported with recommendation as sub H2.
Thank you very much. Appreciate your testimony. Next up on the agenda, we will be taking out House Bills 5283 and 84, the health data utility bills, which myself and Representative Vanderwall sponsored. There are substitutes before you. Changes include adding additional language to strengthen security and privacy, as was brought up in one of our earlier committee hearings, strike the section pertaining to longitudinal health records, and added language issuing a request for proposal to a health information exchange to operate the health data utility. We do have a card to read in. Michigan Nurses Association supports both bills. And with that, we will move to adopt the substitute and then vote to report House Bill 5283. Representative Reingens moves to adopt the H1 substitute to House Bill 5283. Godey's call of the chair. Health policy will come back to order. We have several subs, so I just wanted to double check that we were on the right one. So we will move to, Representative Rankins will move to adopt the H1 substitute to House Bill 5283. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witset.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Rankins.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Next, we will be taking up House Bill 5284, which has a substitute H1 that you have before you. Changes include tiering the funding given to the health data utility. It will take it from one lump sum of $10 million to $6 million in 2025, $7 million in 2026, and $8 million in 2027 and each year after. Thank you to Minority Vice Chair Vanderwall for working with stakeholders to get this bill ready. With that, we will move to adopt the substitute and then vote to report House Bill 5284. Representative Roth moves to adopt the H1 substitute to House Bill 5284. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witset.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia. Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Rangans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Going back to House Bill 5283, we will move to, Rep. Rangans moves to report House Bill 5283 with the recommendation as the substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witset.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Rangans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
No.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 13 yeas, 1 nay, 0 pass. The motion prevails.
With that, we will move to report House Bill 5284, sponsored by Minority Vice Chair Vanderwall, with recommendation as the substitute H1, moved by Representative Roth. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witset.
Yes.
Carter.
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller, Reingens,
Yes.
Vanderwall, Filler, Mueller, Van Workum,
No.
Roth,
Yes.
Schmaltz,
Yes.
Thompson. Madam Chair, you have 13 yeas, 1 nay, 0 pass. The motion prevails.
Next on the agenda, we will be taking up Senate Bill 668, sponsored by Senator Hertel, which would allow individuals to access physical therapy services without a provider referral and remove limitations on the length of time that a physical therapist could rehabilitate an individual who does not have a referral. Representative Glanville moves to report Senate Bill 668. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller, Reingens,
Yes.
Vanderwall, Filler, Mueller, Van Workum, Roth. Pass.
Yes, sorry.
Schmaltz.
Yes.
Madam Chair, you have, Thompson. Madam Chair, you have 12 yeas, 0 nays, 2 pass. The motion prevails.
Next on the agenda, we will be taking up House Bill 5636, sponsored by Representative Pohutsky, which would allow for the licensing of freestanding birth centers in Michigan and has a substitute H2, which would be in front of you and will sponsor, and the bill sponsor spoke to the sub while she was giving testimony last week. With that, we will move to adopt the substitute and then move to report House Bill 5636. Representative Carter moves to adopt the H2 substitute to House Bill 5636. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller, Reingens,
Yes.
Vanderwall, Filler, Mueller, Van Workum,
Yes.
Roth,
Yes.
Schmaltz.
Yes.
Madam Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Carter moves to report House Bill 5636 with recommendation. Madam Clerk, please take the vote.
To report with recommendation as substitute H2, Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller, Reingens.
Yes.
Vanderwall, Filler, Mueller, Van Workum,
No.
Roth,
No.
Schmaltz,
No.
Thompson. Madam Chair, you have 11 yeas, 3 nays, 0 pass. The motion prevails.
And I apologize. We have lots of cards and lots of bills today. Wayne State University had a card of support on Senate Bill 668. Next up on the agenda, we will be taking up House Bill 4833, which streamlines the process for substance use disorder service program licensure, which has the substitute you should have before you. Representative Perry was not available to speak to the changes, so I will mention them briefly. This bill maintains important protections for patients receiving services while also reducing duplicate licensure and administrative burdens. The H1 sub before you adjusts the bill language to reflect input from stakeholders and ensure the bill is clear in its intent and application. The specific changes you'll see include adding in reference to the definitions of substance use disorder prevention services, substance use disorder treatment, and rehab services. It clarifies that a license is required for entities providing substance use disorder treatment and rehabilitative services, clarifies licensure exemptions to reflect that a license is not required for entities providing only substance use disorder prevention services, entities otherwise licensed to provide psychological, medical, or social services, a licensed hospital, or a licensed psychiatric hospital or unit. And finally, it clarifies that entities subject to licensure, sanction, or other action from the department, and those that offer substance use disorder treatment and rehabilitation services. This language aligns with the goals of the bill to clearly indicate who is required to be licensed and who is not. Do we have cards? Yes. Laura supports 4833. With that, we will move to adopt the substitute and then vote to a report. House Bill 4833, Representative Farhat moves to adopt the H2 substitute to House Bill 4833. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Farhat moves to report House Bill 4833 with recommendation as the substitute H2. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The motion prevails.
Next, we will be taking up House Bill 5616, which also has the substitute that you should have before you. To speak to the substitute, Representative Steckloff. Thank you for patiently waiting and coming in on this snowy day.
Good morning, everyone. Chairwoman Rogers, members of the committee. Thank you for the opportunity to testify today on an issue that impacts both the financial burden and patients and the efficiency of our healthcare system. You will recall back in June on the substance of the bill, I appreciate your time back then. I promise to keep things quicker today, as I know you have a lot on your plate. Before you is an H1 substitute that is the result of earnest, good faith, clarifying discussions between Laura, Michigan's eye physicians and surgeons, and LSB. There are two very minor verbiage clarifications. One in Section 2, which adds notes that the section applies to pharmacists and not dispensing prescribers. And then another one in Section 3, which deletes a cumbersome phrase to tighten up the section. Additionally, there is one small yet substantive addition, which can be found in the new Section 4B, which specifies that the bill does not apply to compounded drugs under Section 11748B. That's it for the changes, and I appreciate any additional questions you may have. As you may recall, this is a pretty straightforward bill, and honestly, it's kind of been a lot of fun for me, as many of you on both sides of the aisle have come to tell me that seems like pretty common sense solution, and I look forward to seeing the passage of this bill.
Thank you very much, Rep. Stuckloff. With that, we will move to adopt the substitute and then vote to report House Bill 5616. Representative Conlon moves to adopt the H1 sub to House Bill 5616. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Conlon moves to report House Bill 5616 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The motion prevails.
Next, we will be taking up House Bill 5178, a syringe services bill sponsored by Representative Reingans, House Bills 5371 and 72, sponsored by Chair Braybeck and Rep. Green, and House Bill 5785, sponsored by Chair Braybeck, which have substitutes that you should have before you. These bills return us from the subcommittee on behavioral health, and give a brief overview of the testimony heard in her committee and the changes, including in the subs, we welcome Chair Braybeck. And actually, we're grouping the votes of the subs together first, but you can report on all the bills that are before us from your committee, which has been extensive, and we really appreciate your work.
Thank you so
Begin
much.
whenever you're ready.
Thank you, Chair. I appreciate it. Committee members, good morning. So first, we'll start, as the chair said, with 5178. I'm grateful to the Behavioral Health Committee for their work and grateful to be here before you. This is a Representative Reingans bill, and it would empower localities to create syringe service programs, or SSPs, if they so choose. Again, they get to choose. So SSPs are a key component in our state's harm reduction strategy to protect Michiganders from opioid overdose and death. They currently operate in many counties across the state, doing great work and are a great service for the folks here in Michigan. SSPs offer wraparound services, including coaching and connection to substance use disorder treatment, disease testing, overdose prevention, and helping participants access medical care as well. SSPs have long been shown to reduce the number of deaths related to opioid use and reduce incidence of disease spread through sharing needles, such as HIV and hepatitis C. There's a sub before you, as the chair said. This is the work of many months by Rep. Reingans and her team and harm reduction advocates, HHS, the Michigan State Police, the prosecuting attorneys, and Michigan Sheriff Association. I'll go through some of the details of that H1 sub. It defines an individual who participates in a program. It adds language to protect people transporting or possessing clean needles. It removes general immunity from sale and manufacturing of drug paraphernalia for program participants. It includes protections for licensed, registered, and otherwise authorized health professionals to sell drug paraphernalia, meaning clean syringes, to a program or individuals who participate in a program. And it removes the section on immunity for use, as people are not normally prosecuted for use, rather they are prosecuted for possession. Every group that this work group worked on the substitute are in support, with the exception of the Michigan Sheriff's Association. By passing this bill, we would expand access to SSPs to some of the counties hit the hardest by the opioid epidemic, which could save hundreds of thousands of lives. And I urge a yes vote.
Thank you. Do you want to go ahead?
Do you want to keep going? with the
Well,
other
let's
ones, or
let's do
what
one
do you
by
wanna
one.
Okay.
Are there any questions? All right. Representative. Representative Glanville moves to adopt the H1 substitute to House Bill 5178. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller, Reingans,
Yes.
Vanderwall, Filler, Mueller, Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Glanville moves to report House Bill 5178 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
No.
Roth.
Pass.
Schmaltz.
No.
Thompson. Madam Chair, you have 11 yeas, 2 nays, 1 pass. The motion prevails.
Go ahead and continue, Rep. Braybeck.
Thank you, Chair. Next, we are going to be talking about certified community behavioral health clinics, or CCBHCs, as we like to refer to them. As many of you know, here in our state, as well as across the country, we're in the midst of a mental health crisis, and folks really struggle with timely access to care and comprehensive care. CCBHCs are a way to be able to address those issues. You all may recall that Senator Stabenow was on the federal level, was one of the leads nationally for this. Michigan has participated in the federal CCBHC demonstration program since 2020 and shown incredible positive outcomes. What we have seen is that access to care is increasing and hospitalizations are decreasing, which is exactly what we want to see. But the federal demonstration is nearing its end, and so it's essential that we codify the CCBHCs into state law to protect these long-term services. I've been very proud to work with our colleague, Representative Green, on this, and so I'm excited that it's a bipartisan package. 5371, what it does is it establishes a prospective payment system to sustainably fund CCBHCs. So that ensures consistent advanced funding that aligns with federal methodologies. It also sets an implementation date. Representative Green's bill, that's 5372, that really, again, ensures that all of our policies here in Michigan align with the federal CCBHC definitions and requirements, so that we're making sure that we are following that federal guidance. Again, this would allow folks care regardless of acuity, and it's insurance agnostic, making sure it's 24/7 care, making sure that folks, when they are in crisis or whenever they need it, when they're ready to be able to get that care, that they can get it, that they are not turned away. And so we're excited for this. It would align with other states. Other states have already committed to CCBHCs as a permanent solution. And so I would be excited if we could join them. Again, I want to note the partnership with our department here with HHS. We have worked hand in hand with them on that and continue to do so. We'll probably have a couple small technical tweaks, but I have been so honored to work with them on this. And I can just say, as a mental health care provider, we need more ways for folks to be able to access services, and this is another one. The subs that you have before you for both of the bills, it's an H3 sub for 5371 and an H1 sub for 5372. It just, again, make sure that it's very, very clear that it requires the state to comply fully with all federal financial requirements and allows the certification of private and nonprofit organizations as CCBHC demonstration sites.
Thank you. Are there questions? Representative Kofia.
Thank you, Madam Chair, and thank you so much, Representative Braybeck, for this is critically important. I'm a very big supporter of CCBHCs to meet our mental health needs, and I am curious if, as we talk about making sure that it meets all federal requirements for CCBHCs, one of the things that has come up for me in my region, which is very rural, is the challenge to meet some of the CCBHC requirements, particularly around things like 24/7 access. Because I'll give an example in Benzie County, which is 20,000+ people, and Rep. Roth and I both represent Benzie County. The sheriff pointed out to us that even their road patrol, they have difficulty staffing for 24/7. So I'm wondering if there's some possibility to work with you to make sure that if we're requiring nonprofits or whichever entity to qualify as a CCBHC, can there be some flexibility to work with rural settings where it's frankly just not possible? We don't have the staffing, we don't have the funding, we don't have the people power to staff at a 24/7 level, as one example of just some of the challenges with a rural context.
Yeah, and that's one of the things that we've looked at, and in fact, there already are some provisions around that that CCBHCs can partner and have those partnership agreements. I believe they need to make sure that they have 51%. The organization themselves needs to provide 51% of the services, but then can do those partnerships because of exactly what you're talking about. So there are already some of those stipulations in there.
Okay. Thank you so much for your work on
No
this.
problem.
We'll keep the conversation going. I'm supportive, and I'm really trying to get rural communities to look
Yep.
at this as a model, and this is just one of the barriers that I've heard about.
Yeah.
Thank you.
Well, I will also add that we had Director Williams, who is a director of a much more rural district, testify on this several times. And so she is a great hub of and wealth of information.
I would agree. My team and I have met with her, and we're in conversation because I am looking for those examples. But thank you
Perfect.
again for this great work.
That's great.
Representative Conlon.
Thank you, Madam Chair. Thank you for your testimony, and I am very much in support of your bill. But can you add a bit about how the CCBHs work with the community mental health?
Yeah, sure. So it's different in every county, right? And so what right now, CMHs, you have to be in an acute state or persistent. So not everyone falls into those categories, right? So someone may be want help. We were just talking about substance use disorder, right? So someone may be in that state of readiness to go get that and walk through that door and go. Let's say they go to a CMH, but they don't fit into those categories, right? And so then they would be given a referral potentially, or told, oh, maybe try here or try there. And so we're not, when that person is ready to be able to get the help, we're not then harnessing that in that moment. CCBHCs allow us to do that.
Any other questions? Seeing none, Representative Fitzgerald moves to adopt the H3 substitute on House Bill 5371. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes, thank you.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Rangans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Fitzgerald moves to report House Bill 5371 with recommendation as substitute H3. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kofia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Rangans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Sorry, sub.
We are voting to report 5371
Sorry.
as sub H3.
All right. I'm awake.
And your vote is
Was a pass.
a pass. Schmaltz. Pass? Pass.
Yes.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 3 pass. The motion prevails.
If you want to vote yes, you can borrow my call. No. With that, we will move to adopt the substitute and then vote to report House Bill 5372. Representative Roth moves to adopt the H1 substitute, House Bill 5372. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Rangans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Roth moves to report House Bill 5372 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kofia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Rangans.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The motion prevails.
We have next up House Bill 5785. Representative Brave. Oh, sorry. I do have cards to read in. Well, you go ahead.
Okay. Thank you, Chair. I appreciate it. This is the last bill that we're reporting from behavioral health. This is a bill that's been 30 years in the making, if you can believe it. And so right now, here's the issue. Currently, limited licensed psychologists or master's level psychologists are required by law to work with lifelong or work-long supervision. So for their entire career, they need to have supervision. No other master's level mental health care profession needs to do that. And so this bill addresses that. And so what it would do, it would allow qualified master's level psychologists to practice without constant supervision, but to be able to practice independently, they must have gone to an accredited school. They have to have the master's degree, obviously, from there, and then 4,000 hours or 2 years of supervised experience, which is in line with a lot of the other, again, master's level mental health care professions. So we know that this will improve access to care. Again, we have workforce issues and access issues. So this will help improve access to care so that we have more folks available to be able to address our shortages. And it will also remove some unnecessary barriers. I always found it strange that when I was a young psychologist here in Michigan, and I was just a newly minted licensed psychologist, that I could legally supervise a therapist, a master's level for a person who was in the field for 30 years. And that didn't make much sense to me. I would have wanted to learn from them, not the other way around. And so this allows our master's level folks to be able to have the training, do the supervision in a timely manner, and then be able to practice on their own. I will also mention that we had over 930 cards of support that came in for this. And so I just wanted we didn't read them all in, obviously, but there's a lot of support for this. There's also an H1 that I wanted to share with you. And that just updates the composition of the Board of Psychology to include more master's level psychologists, and it also clarifies the timeline of changing the supervised work hours for those master's level folks. Thanks, Chair.
Thank you. Are there questions? Seeing none, we will read it in the cards. Supporting the bill, Michigan School of Psychology. Supporting the bill, Blue Cross Blue Shield of Michigan. Supporting the bill, as you mentioned, actually 940 individual limited licensed psychologists, and we will upload those electronically. And supporting the bill, Michigan Psychological Association Masters Committee. And supporting the bill, Dr. Ellen Kite, President of the Michigan Psychological Association. With that, we will move to adopt the substitute and then vote to report House Bill 5785. Representative Reingans moves to adopt the H1 substitute to House Bill 5785. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingen.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Reingans moves to report House Bill 5785 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Reingen.
Yes.
Vanderwall. Filler. Mueller. Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 13 yeas, 0 nays, 1 pass. The motion prevails.
I am going to quickly read in House cards for House Bill 5178 as well. MSMS supports the bill. The Grand Rapids Red Project supports the bill. Michigan Society of Addiction Medicine supports the bill. Wellness Services supports the bill. Harm Reduction Michigan supports the bill. The HIV/AIDS Alliance of Michigan supports the bill. Access Community Health and Research Center supports the bill. Mid-State Health Network supports the bill. Sacred Heart Rehab Center supports the bill. Michigan Department of Health and Human Services supports the bill. Michigan Association of Health Plans supports the bill. Michigan Nurses Association supports the bill, and not supporting the bill is Michigan Sheriff's Association. Lastly, we will be referring House Bill 5904 to the Committee on Regulatory Reform. Representative Hodsma moves to refer House Bill 5904 to the Committee on Reg Reform. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Witsit?
Yes.
Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Cuffia?
Yes.
Conlon?
Yes.
Farhat?
Yes.
Fitzgerald?
Yes.
Miller? Reingens?
Yes.
Vanderwall? Filler? Mueller? Van Werkum?
Yes.
Roth?
Yes.
Schmaltz?
Yes.
Thompson? Madam Chair, you have 14 yeas, 0 nays, and 0 pass. The motion prevails.
Representative Fitzgerald moves to excuse absent members. There being no objection, motion prevailed by unanimous consent. Thank you all very much for traveling on this very snowy day. I really appreciate your attendance, and we will continue our work next week. There being no further business before the committee will stand adjourned.